Let's talk about the general adaptation syndrome or the theory of stress by Hans Selye. Hans Selye was a Hungarian endocrinologist, first to give a scientific explanation for the biological stress. In 1935, Selye started to work on his theory of the influence of stress on a person's capacity to handle the pressure of injury and disease. He discovered that patients with an assortment of ailments demonstrated lots of similar symptoms, which the associated with their effort to cope up with the stress of being ill. His model states that an event that threatens an organism's well-being to stressor leads to three stages, which are the alarm, resistance, and exhaustion. The first one is the alarm, which begins upon encountering a stressor. The body reacts with fight or flight response, and sympathetic nervous system is achieved, and the body's resources are now mobilized. Hormones such as cortisol and adrenaline release into the bloodstream to meet threat or danger. But on the other hand, the excess production of this cortisol hormone can cause damage to cells and muscle tissues. Stress-related disorders and disease from cortisol include cardiovascular condition, stroke, gastric ulcer, and high blood sugar levels. The second stage is the resistance, which happens when parasympathetic nervous system returns many psychological functions to normal levels while body focuses resources against the stressor. Blood glucose levels remain high, cortisol and adrenaline continue to circulate at elevated levels, but outward appearance of organism seems normal. There are prevalent increase in heart rate, blood pressure levels, and breathing. Problems begin to manifest when you find yourself repeating this process too often with little or no recovery. Ultimately, this moves you into the final stage or the exhaustion. If stressor continues beyond body's capacity, organism exhausts resources and become susceptible to disease and death. Chronic stress can damage nerve cells into tissue and organ. Particularly vulnerable is the hippocampus section of the brain. Thinking and memory are likely to become impaired with tendency towards anxiety and depression. In conclusion, Hans Selye's theory profoundly influenced the scientific study of stress. Stress is a state produced by a change in the environment, and the nature of stressor is variable. The individual appraises and copes with the stress to reach the goal of adaptation. The process is called coping with the stress, and it is achieved through a compensatory process with physiologic and psychological components.
Thank you for listening.